So welcome everybody. Thank you again for joining us today for this, I believe, fifth part in the gestational diabetes prevention and awareness training. Today we do have Crystal back with us again to speak on the topic of nutrition and physical activity during pregnancy. So we'll be hearing all about that today. So we're here once again today with Crystal Bomberry, IDHC's diabetes wellness worker in the West region. Crystal is a Mohawk woman, Turtle Clan, from 6 nations of the Grand River Territory. She has worked with the IDHC since 2009. Crystal serves Indigenous communities, inspiring healthy change by encouraging all to be active and eat foods that nourish their body, mind, and spirit. Among her many talents, Crystal is a certified CanFit Pro, personal training specialist, and an East to West yoga teacher. And she's a very dedicated speaker and presenter, and I know has put a lot of time and effort into the presentation that she will be giving today. So with that, I'm going to stop sharing my screen, and I'm going to turn things over to Crystal, who will take care of you for the rest of the training today. Welcome everybody, and welcome Crystal.
Now, and Jessica, for that wonderful introduction once again. Scano, hello everyone. It is a great pleasure to be here with you all once again during this gestational awareness and prevention webinar series. Today I'm going to be talking about healthy eating and physical activity during pregnancy. Lots of information to get through today. So in our limited time frame, and of course we know that these are very broad subjects, so we're gonna get through them as best as we can, and if there's any questions, as Jessica said, feel free to place them in the chat box, and we'll get through them at the end. So welcome everyone, thank you for joining us today. So we're going to start off just with the general benefits of healthy eating during pregnancy, and as we all know, there's countless benefits to healthy eating, but I'm going to try to capture some of the main benefits here that would greatly benefit mom and baby. First of all, there's an overall promotion of healthy functioning for the body, and it helps to stabilize the energy levels when mom is having a well-balanced diet. It also helps forming healthy habits for the family. So you'll see in a lot of our resources and in the Pregnancy Wellness Toolkit, and just within the gestational prevention program in general, we're referring to creating healthy habits for the family. So if mom is doing these types of things to prepare prior to pregnancy, that's great. Sometimes these types of things don't come to her awareness until she's pregnant and having increased access to information and different members of her care team. And that's okay too. And then just promoting it after pregnancy as well, and after birth, for lifelong health. It also helps to ensure healthy weight gain. So this is a good focus as well. It reduces the risk of maternal nutritional deficiencies and also developmental harm to baby. And then, of course, reduce risk of gestational diabetes, GDM complications, and type 2 diabetes. And some of this information was taken from the Sensible Guide to a Healthy Pregnancy by Health Canada. General recommendations for healthy eating during pregnancy are, of course, to enjoy a variety of colorful foods and having approximately 3 meals a day plus some healthy snacks, maybe 2 to 3 healthy snacks. And of course, this varies from individual to individual, but the key here again is stable energy levels and just sort of promoting that overall sense of well-being, and especially in the case of high risk for gestational or type 2 diabetes, we want to just make sure that we're concentrating on those stable energy levels to promote a healthy blood glucose level. Also, refer to the new Canada's Food Guide to learn more about general food groups and the importance of a balanced plate. So this is just a resource that you can access online and download. Just a special note here that I added: modify by including traditional and cultural foods in appropriate food groups. So we'll talk a little bit about that. Another recommendation is to take a prenatal multivitamin daily and ensure that it has 0.4 milligrams of folic acid and 16 to 20 milligrams of iron. Of course, you will consult with a healthcare provider about this. You need a little bit more food than normal during pregnancy. So this would be equivalent to maybe another small meal. So there's that, that common myth that we heard over the years, and not so much these days, I don't think, but over the years, that Mom is eating for two. Theoretically, because she's growing a baby, she's eating for two, but not technically. So she's really only just sort of eating for just regular amounts of food plus a little bit extra. So it's not anything substantial. If diagnosed with gestational diabetes, want to make sure that community members are consulting with a registered dietitian, and there's probably even some perhaps on this webinar. So nourishing body, mind, spirit, and emotion with healthy eating. So some of the general guidelines for a healthy meal here, and again, if you refer to the new revised Canada's Food Guide from 2019, there's a beautiful visual of the general makeup of a plate. So you can see there are plenty of vegetables and fruit, a quarter plate of some types of protein foods, and of course lots of water, and then also a quarter plate of whole grain foods. And we can talk a little bit more about examples for that. In terms of whole grain foods, I think in my experience in working in this area, a lot of people often wonder, well, what are whole grain foods? Because traditionally in that section of the plate, we would always see the very high starch types of foods like potatoes, pasta, rice, those kinds of things. So some other examples could be quinoa or whole wheat pasta, couscous, bulgur, steel cut oats, brown rice, wild rice, those kinds of things. And then some protein sources could be lean meats, chicken, turkey, fish, and then also alternatives such as beans, the legumes family, so peas, beans, and lentils, and then also other things like eggs, peanut butter. Just a note here for healthy fats, you don't really see it on here, but you can get those healthy fats from nuts and seeds, fatty fish, olive oil, avocado, those kinds of things. And then with regards to the vegetables and fruit, you know, we see this at the top of the list because we want to make sure that the majority of the meal is comprised of vegetables and some fruit. Preferably more vegetables. So if you have a nice hefty salad on that side of the plate, that's great. And then remember, you can really make a salad into a full complete meal by adding different components of those other food groups or sections of the plate, such as a quinoa salad with lots of vegetables in it, maybe a protein source, maybe some avocado. So there's a whole bunch of ways to make sure that we're getting that well-rounded diet. So, and just notice too that the new Canada's Food Guide does not refer to the milk group. However, it is important to acknowledge that there are foods that do provide us with that calcium and vitamin D that milk and milk products are still very popular for. But in cases where dairy is not desirable or there's intolerance, alternatives and supplements are necessary. So fortified soy beverages is an example, almond milk, maybe rice milk. And calcium is also found in other foods, so that's important to acknowledge as well, although in lesser quantities than dairy, of course. But some other examples are spinach, kale, broccoli, almonds, and many other foods. Definitely seeking guidance from a registered dietitian if these nutrients are not commonly found in the foods that one is consuming. A registered dietitian can provide that specialized advice, and I think that's so important. I think in general, any person can benefit greatly from consulting with a registered dietitian, but in particular where mom has to pay extra special attention to her nutrition and food intake, it's definitely very beneficial to consult with the dietitian. So moving on to this little resource here that I think I might have mentioned it previously very briefly, but information about the 5 white gifts and being very aware of these ingredients here. And in our teachings provided by our elders, we've come to know that the 5 white gifts were really introduced probably around the 1940s to our Indigenous communities when the government began to issue ration boxes consisting of the 5 white gifts. And these were the white milk or cow's milk, lard, salt, flour, and sugar. So we know that these are not a part of the traditional Indigenous diet. So it's really important just to create awareness about these particular ingredients and ensure that we make people aware that the majority of processed and packaged foods are very high in these ingredients, and consumed in abundance can create, or consumed regularly can create some health concerns. So it's really important to be aware of that and substitute traditional foods wherever we can, and really just whole real foods. But we would learn over time that these ingredients and foods that are very high in these ingredients have largely substituted some of our traditional foods. But there's a big revival in the awareness of our traditional foods. And so wherever we possibly can, we're always promoting that. And where traditional foods is not really accessible, just continuing to promote contemporary healthy foods, whether it be from a local market or a grocery store, or perhaps local hunters. One of our very nice and popular resources here is the Make It Sacred, Remembering the Spirit in Our Food resource. So it really kind of pertains to having that spiritual or reciprocal relationship with our real whole foods that come from Mother Earth. And this is so important because as Indigenous peoples, we're generally spiritual people and have that deep gratitude and appreciation for all of the things that we're gifted with from the earth. So some of the things that you see here are very significant in terms of mindful eating, but also just the concept in general of holistic wellness. So you can see a lot of symbolism here as well with regards to the turtle shell being used as sort of the backdrop for promotion of these Indigenous foods that I'm going to talk about here. And just be aware that Indigenous foods obviously vary from region to region and nation to nation. So this is just one example of foods that are sort of generally available in this area of Southern Ontario, in, I guess you could say, where I live, Six Nations of the Grand River or Haudenosaunee territory, and sort of in the general geographic area. So the turtle there, as you can see, has the 13 plates on the back, which represent the 13 grandmother moons. And the 28 tabs on the outside represent the 28-day cycle. And this just kind of is a continual reminder about the continuity of all things, everything in nature, the continual cycle of life. And I think it's a wonderful reminder when it comes to mindful eating, because if we can keep that sort of concept at the forefront of our minds when we're eating, choosing foods, preparing food, and sharing food with others, all those different concepts related to mindful eating, we can really establish a very well-rounded and beneficial eating routine and understanding in general. So some of the concepts here are intention and love. And our traditional teachings, they talk about having a good mind when we're preparing food. So whether it be for ourselves or whether we're preparing for others or community events, to make sure that we have a good mind and that we're aware of our energy levels, because we're going to be sharing that. So when we're touching the food and interacting with the food, we're going to be sharing that. And, we're sort of, in a way, putting that energy into the food. So prepare it with love and a good mind and good intention. And again, that goes for ourselves. And of course, in the case here of promoting healthy eating with mom and baby, having her sort of have that intention in her mind and gradually adopting these mindful eating principles as she goes along. Awareness and gratitude is also a part of this mindful eating concept, being aware of where our food comes from, investigating a little bit, asking questions, trying to possibly create a little garden of your own. And then of course, always having deep gratitude for the foods that we are provided with. Again, whether we grow them ourselves, whether we obtain them from a market or a grocery store, it's just so important to always acknowledge and be grateful for the sources of that food and where it came from, as well as the journey that it made to get to your table. Optimal ingredients. So we're talking really about whole, real foods, making sure that we understand that if it's packaged and processed food, to be aware of the label, check the label out and check the ingredients list, and try to ensure that there's at least some nutritional content in a packaged and processed food. We know, for the most part, they tend to be quite abundant in some of those ingredients I mentioned earlier. Preparation really refers to taking the time and the mindful, mindful awareness and the effort to prepare our food from scratch if we can. And that's kind of a really, really important life skill, something again that can benefit the whole family and will eventually be passed down to our little ones as they grow into young people and adults. Enjoyment, that refers to thoroughly enjoying the food in all senses. So, the taste, the smell, just the ability to sit and just eat our food in relaxation. That is enjoyment. We can't really enjoy our food thoroughly when we're rushing through the process of preparation and rushing through eating. We're not really mindfully present when we're doing that. So to really truly enjoy it means to be present. And also, of course, relationship building with sacred food and Mother Earth. And then listening to our bodies and eating to be satisfied rather than full. That is another mindful eating concept that is very, very important. Oh, and I just wanted to mention, you can also see the IDHC traditional food plate resource and our nutrition sheets, as well as mentioned earlier, the Canada's new revised food guide. So to be a mindful eater, and again, this is something that we can really practice, and it is something that can stay with us for the rest of our lives. So first of all, see food and your whole self as sacred. As soon as we start to have a shift in that perspective, we might be able to really kind of change our behaviors around eating. And also self-reflect on eating habits, routines, and overall health. So this takes, you know, that personal, honest self-reflection and the time to do that to determine where we might be able to make changes. Answer honestly, what, when, why, how, and where. All these things related to our eating. What am I eating? When am I eating? Why am I eating? How am I eating? In what fashion? You know, am I eating fast? Or that's something to pay attention to. And also where are we generally eating? Have an open mind to learning, set specific healthy eating goals, and then also meal plan is a big one because oftentimes people, if they're not really planning meals, they will tend to, again, be rushed in the process, and we will sometimes grab convenience foods or just not really plan a holistically beneficial meal. And time management, of course, goes along with that. For practice, take the time to prepare food. It may involve reprioritizing, also juggling time more effectively or differently. And this, again, takes some reflection. We have to look at if we're really interested in making, you know, those long-term goals and really truly benefiting from the foods that we eat and feeling better overall, we do have to look at how we're currently doing things. So eat slow and eat at the table. This is another one, just in my own personal observations and whatnot in the past number of years. I noticed people aren't really eating at the table very much anymore. Kids are walking around while they're eating, you know, eating while they're watching TV or, you know, playing on their technical devices. There's a lot of values and wonderful things that can come from that traditional meal sitting at the table and promoting unity, promoting conversation and good relations, and overall just that relaxed atmosphere. So that is a wonderful thing to reestablish and reintegrate into homes where it's not necessarily happening. Consciously relax while eating, and this is important so that we can properly digest our food and then, of course, gain the most from the nutrients in the foods. Gratitude and prayer, this is something that maybe you integrate into your daily eating practices, which I feel, again, just sort of really enhances the whole eating experience in a wonderful way. And also resist eating as a stress reliever. So again, this takes some honest self-reflection. I think all of us can relate to what they call comfort foods or soul food. But in reality, if you were to flip that around and think of it from a very holistic perspective, you know, comfort food and soul food should be those foods that are truly, truly beneficial to our health and wellness. And be happy, be present, and enjoy. So those are some, and again, that was, you know, fairly quick as we went through that, because I know that there's lots and lots of detail that can go along with these things, and I'm sure that there's going to be a lot of questions and maybe some discussion that comes along after. But for now, I wanted to get into the exercise during pregnancy, because there are a lot of areas here to be considered with regards to promoting exercise for moms, either in your groups, maybe for yourself or your community. And exercising during pregnancy is really truly a gift for mom and baby. So there are, again, countless benefits of exercise during pregnancy, and overall, it's safe to say that it improves endurance, muscle tone, and strength. And this is very beneficial for labor, delivery, and post-recovery. And of course, we know that, you know, if we develop these behaviors and these habits, that they will stay with us for the rest of our life. It also promotes a healthy range of motion, especially with exercises like prenatal yoga or gentle stretching. And this is important because there's a perception out there that stretching is to increase flexibility, and that's not always necessarily the case. Because what happens when we have that in mind is there's a tendency to overstretch and to push our boundaries. But with regular practice, we don't really have to push our boundaries. We just will naturally engage in these very gentle movements, and over the course of time, promote a healthy range of motion, which, yes, may result in increased flexibility, but just kind of getting away from that overall goal, just really promoting a healthy range of motion is sufficient, because we want to make sure that, overall pregnancy is pain-free, comfortable, and then, of course, as we move along, that the delivery is as smooth as possible. It also helps to increase energy levels. So it releases those feel-good hormones called endorphins. And of course, if we're feeling better because of it, or energy levels are increased, this will help to reduce the risk of depression, which can also hit anybody really, but you hear situations of this occurring frequently with some moms-to-be, or even after delivery. It helps to ensure appropriate weight gain. Again, in consultation with a healthcare professional, appropriate weight gain can be determined during that consultation. Reduced risk of various pregnancy and birth complications, also GDM and type 2 diabetes. If GDM is diagnosed, there's through regular exercise, there's a decreased risk of complications, then of course, possible diagnosis of type 2 diabetes. So we want to decrease the risk of all of that. As I said, it helps to reduce stress, it improves sleep quality, it improves confidence and self-esteem, as any one of us can probably relate. As we start to embark on that journey of making changes and achieving those small steps as we go along, it feels really, really good. And that feeling of self-esteem, it comes from within. It's an image that we create of ourselves. And I think that is huge. And it's going to, again, be beneficial for all of life. So if we can help moms to develop that slowly and gradually through gentle exercise, definitely will stay with her and carry over to the baby as well, in terms of having a relaxed pregnancy and just being, again, holistically more healthy from the increased activity. It also improves overall body and breath awareness. So again, with body awareness, if you're more aware of how the muscles and joints work, you become more informed about different exercises. That's just going to improve your overall balance, stability, and then, of course, when it's done in partnership with proper breathing, there are many health benefits to be gained through that. And then, of course, the healthy habit for lifelong wellness. So a lot of these were taken from an article called the Canadian Guideline for Physical Activity Throughout Pregnancy. And I'm just going to be referring to that a little bit in some of the other slides. So the Canadian Guideline for Physical Activity Throughout Pregnancy, I brought this right into this presentation because I thought it was really, really important, particularly because in one of the last webinars, somebody had asked me at the end, if a woman, isn't it dangerous for a woman to exercise if she hadn't been active prior to her pregnancy? So I wanted to bring this into this presentation to create awareness around the necessity for physical activity throughout pregnancy, regardless of inactivity beforehand. And I'm going to make some clarifications around contraindications as well. So number one recommendation in the paper is that all women without contraindications should be physically active throughout pregnancy. This includes women who were previously inactive, women diagnosed with GDM, and women categorized as overweight or obese. The number two recommendation was that pregnant women should accumulate at least 150 minutes of moderate intensity physical activity each week to achieve clinically meaningful health benefits and reductions in pregnancy complications. Also, number three is physical activity should be accumulated over a minimum of 3 days per week. However, being active every day is encouraged. And of course, as activity increases, frequency can also increase. So minimum is 3 days per week though. Number four is pregnant women should incorporate a variety of aerobic exercise and resistance training activities to achieve greater benefits. So add yoga and or gentle stretching. This may also be very beneficial. Pelvic floor muscle training, so Kegel exercises, may be performed on a daily basis to reduce risk of urinary incontinence. Instruction in proper technique is recommended to obtain optimal benefits. And number six is pregnant women who experience lightheadedness, nausea, or feel unwell when they exercise on their back should modify their exercise position to avoid the supine position. So that can be avoided altogether. I wanted to mention this form called the PARMED X for pregnancy. Some of you may be aware of it. It's by the Canadian Society for Exercise Physiology. And just a little note here that the form was originally created by Dr. L.A. Wolf of Queen's University, and then updated by Dr. M.F. Matola of University of Western Ontario. So this is a form that you can find online, and I can also share it in the chat box in a little bit. I can share the PDF attachment, but it is a 4-page document. And it's really a guideline for health screening prior to participation in a prenatal fitness class or other exercise. Again, I feel like this is really, really important because we can't just assume that every pregnant mom can just go right into exercise. So it is really important just to take that extra time to go over this and possibly suggest it for mom so that she can, fill in where she's supposed to fill in and then consult with her healthcare professional. So section A is really just the patient information. She will just fill out her general info. Section B is the pre-exercise health checklist. So in this section, it asks if she's experienced things like miscarriage in an earlier pregnancy, other pregnancy complications, and they're all yes and no questions. So she just simply has to check off yes and no to all of these questions pertaining to her pre-exercise health checklist. And then the second part of that is the status of her current pregnancy. So again, several questions pertaining to the status of the current pregnancy, to which she will check off yes or no. And then active habits during the past month. She will just list off things that she's been doing, what the general intensity is in terms of heavy, medium, or light. Also the frequency of her activity, how many times per week, and how many minutes per exercise session. So she would fill all that out. And then also it asks questions yes and no about her occupation and the types of activities that are involved in her occupation. So that's all in the pre-exercise health checklist. And then section C is this is the really important part. Well, it's all really important, but the contraindications to exercise. This is where special attention should be given. So there's a section on absolute contraindications, and this one will be completed with her healthcare provider. So there are questions pertaining to ruptured membranes or premature labor, yes and no, persistent second or third trimester bleeding or placenta previa, yes or no. And then again, several other questions that require yes or no answers. Beside that is the relative contraindications. So these are things, obviously, complications that can result from other issues. So the first one says history of spontaneous abortion or premature labor in previous pregnancies, yes or no. Mild or moderate cardiovascular or respiratory disease, yes or no. Anemia or iron deficiency. So these are all other considerations. So there's a note here that risk may exceed benefits of regular physical activity. The decision to be physically active or not should be made with a qualified medical advice. So right beneath that is where the doctor will give a recommendation, either recommended or contraindicated. And then from there, prescription for aerobic activity, muscular conditioning, they will provide their signature and approval. And then there's some general advice for active living during pregnancy. So I wanted to get into a little bit about the aerobic physical activity. And before I get into that, I just want to start by saying sometimes we have this perception that exercise is supposed to be really, really hard, that we should be sweating profusely and breathing hard, and our heart rate should be really pumping. And we need to clarify that light to moderate, we're going to talk a little bit more about the signs of an appropriate light to moderate activity. But the best time to start aerobic physical activity for a pregnant mom might be in the second trimester. This will vary individually. For myself, I was active through my whole pregnancies, but not everybody would be able to do that because there are certain things that one might experience more than another person in the first trimester, which could be, fatigue, really pretty extreme fatigue for some people, and also lots of morning sickness. So second trimester might be the time when some people start, but it will vary. It's recommended to start at 15 minutes per session, about 3 times per week, within the appropriate target heart rate range or the rate of perceived exertion, and we'll talk more about that. But eventually, working up to about 30 minutes per session, at least 4 times per week. And again, at the appropriate target heart rate or rate of perceived exertion. Include 10 minutes of warm up and cool down. This is really important, and I'll talk about why. But for example, low intensity calisthenics, stretching and relaxation exercises should be included in a warm up and a cool down. Using the FIT principle as a tool for planning and monitoring overall physical activity is very, very useful. And I'll go over what the FIT principle is. And the talk test should be able to carry on verbal conversation while exercising. So, that means kind of stringing along at least, maybe 3 or 4 words. But if a person is, gasping for air, and if you've been in that state while exercising, it might be overexerting. And definitely in the case of pregnancy, don't want to get to that point. So the FIT principle pertains to frequency, intensity, time, and type. Frequency means beginning at 3 times per week and progressing to about 4 times per week. Intensity means exercising within the appropriate rating of perceived exertion range and or target heart rate zone. And time refers to starting with about 15 minutes. And it says attempt because maybe a person won't be able to do 15 minutes, but that's the general starting recommendation. Even if it means reducing the intensity. So, 15 minutes of continual movement is really what it's pertaining to, even if it's at the very, very low intensity. Rest intervals would be helpful in that situation. And the last T is for type. Non-weight bearing or low impact endurance exercise using large muscle groups. So I meant to say weight bearing. The non shouldn't be in there. That's a typo. Weight bearing, but low impact endurance exercise. So walking, maybe in the beginning, early stages, people might like to run, stationary cycling, swimming, aquatic exercises, or low impact aerobics. So the prescription or monitoring of intensity. This is the best way to combine heart rate and rating of perceived exertion. So the best way to prescribe and monitor intensity is to bring together the heart rate and the rate of perceived exertion. So you can see here, there's a chart indicating the age, the maternal age. In the middle column is the fitness level or the BMI, and the last column is heart rate range. So this was taken directly from the PARMEDX for Pregnancy forum. And you can see there for, less than 20 years old, there's a heart rate range listed. And then for age 20 to 29 and 30 to 39, these are the general ages that they provided. There's low, active, and fit heart rate ranges for both age categories. The rating of perceived exertion is really just a number, sort of a number chart. And it starts at, I believe it's called the Borg's scale originally. But really, you can check your target heart rate zone by comparing it to the scale shown here. A range of about 12 to 14 on this scale, which is classified as somewhat hard, is appropriate for most pregnant women. So you can see there that the beginning is 6, and then right around the middle is where we would want to be. 7 being very, very light, 9 being somewhat light, 11 fairly light, 13 somewhat hard, 15 hard, 17 very hard, and 19 very, very hard. So going sort of in the middle of that is where we want to be. Another thing I wanted to mention here is the impact of walking. So just in general, walking is very, very much overlooked. And I think the reason for that is because we live in a, in a society that's very much performance-based, very expectation-based, outcome-based, and it's just a lot of information around, I guess you could say, expectations. And we look out there and we see all these things and we compare ourselves to others. And what happens is it can create, mental barriers and sort of a reluctance to exercise. But really, walking is an amazing way to be active, and especially if you're able to vary the intensity and walk, briskly as you start to progress in your walking and sort of increase your intensity levels. Of course, more health benefits will be gained. So the benefits of walking are often overlooked. It does help to strengthen heart and lungs and improves overall fitness, muscle tone, strength, and balance. It helps to improve sleep, relieves stress, and helps combat depression, especially if you're walking, sort of out in nature somewhere, or in the bushes, by the water. These are known benefits of helping to reduce stress and reduce the risk of depression. 30 minutes daily, light to moderate activity, and again, build gradually. So even if it's only 10 or 15-minute walk at first, maybe that'll be in the beginning of the day. And then in the second part of the day or after dinner, you can always get the other portion of that 30 minutes. But the important thing is to build gradually and to break it up if not feeling comfortable to do it all at once. Walk with family, friends, or form a walking club. The social interaction of being around other people during physical activity adds a lot of fun and also increases the gains for mental and emotional health. So there's a lot to be said about getting together with someone and just really enjoying the moment. So with muscular conditioning, it's important to warm up for this portion of the exercise as well. It helps to divert blood and oxygen gradually to the working muscles. It lubricates the joints and gradually increases the heart rate and breathing. We don't want to just get right into full force into a workout without having a proper warm-up. So warm-up could be static movements, such as just very gentle held stretches, or it can be dynamic, which means gentle repetitive movements done in conjunction with regular breathing. So an example of a gentle repetitive movement just might be a gentle lunge back and forth. It could be, when you see people sort of doing a really, really light jog from one point to another, just very, very light. But gentle repetitive movements that really, again, the idea there is just to help with warming up the muscles prior to even getting into static stretches. So people still do both ways. A lot of times you'll hear, don't do static stretching until the end of a workout when your muscles are very, very well warmed up. But, it's really a matter of personal choice, and some people do static stretches prior to warming up. But again, just taking it very gradual, very slow, and definitely incorporating some dynamic in there as well, the repetitive movements. Cool down is also an important aspect of both a muscular or aerobic workout. So this could, for a cool down, definitely gentle or dynamic stretching. Gentle, static, or dynamic stretching, because at that point the muscles are very warm. Include body weight exercises or add light to moderate weights. So again, that can't be emphasized enough. If mom hasn't been very active before and she's just starting to do exercise, body weight is plenty of resistance for anybody. So even if you're considering exercise, body weight is an excellent form of resistance. You don't have to include any added resistance if you don't want to, especially if just beginning. But light to moderate weights is where you want to go if there's going to be added weight. The body parts, training the upper back, the lower back, a little bit of abdomen. As we know, that gets more awkward as the pregnancy goes along and mom's belly gets bigger. So, but again, collectively, when we're talking about the back and in the chest and the front, we're talking about the core. So we want to make sure that we're really focusing on core strength and stability there. Also the pelvic floor, and then buttocks and lower limbs. So just lower body is a good way to classify that. And then of course, just important to summarize that by training all major muscle groups in prenatal and postnatal period. So I think it's, really worth it to mention that it is important in our overall everyday lives to work with our major muscle groups for stability and strength. And of course, if that's happening, prior to pregnancy, all the better, because then mom will already be familiar with these concepts and sort of be already well acquainted with exercises that she can do and adjustments that she can make, as well as precautions to take. So again, see the paramedics for pregnancy forum for precautions for muscular conditioning during pregnancy. Another thing I wanted to make special mention of here is prenatal yoga. Prenatal yoga, I can't say enough, is an amazing form of exercise. And again, yoga in general for everybody. For some of you that aren't aware, I am a yoga instructor as well as a prenatal yoga instructor. And I really promote this because yoga is non-impact, but yet weight-bearing. So non-impact meaning that there is, no pounding or grinding on the joints, such as the ankles, the knees, and the hips, but yet weight-bearing, which means it's strengthening the muscles and the bones at the same time. So that's a wonderful way to exercise and gain numerous health benefits, especially when special attention is given to the breath and the body alignment. So just the simple fact that yoga is done in connection to the breath and to regular breathing, it promotes that mind-body awareness, or you could say mind-body connection. And in yoga, they would say there is no such thing as mind-body connection, because it is all one, it is all whole, which is very true. But we know that in the context of the society we live in, and the environments that we are in, and the atmospheres such as work and family and all these many, many different things that we are doing from day to day, that is very common and very likely that we can become sort of mentally disconnected from where we are. So if we're, working, our mind can be somewhere else. So breathing, and in partnership with our movements and our yoga postures, and even just weight training or any type of exercise, being attentive to our breathing is a wonderful, wonderful way to nurture that mindful presence. And so promoting that overall body-mind awareness is deeply beneficial. The attention to breath induces relaxation. So this is beneficial, of course, for all stages of pregnancy. So, during the pregnancy, during labor, during delivery, and also post-recovery, especially if mom is dealing with some, various complications, or not necessarily complications, but various things, that have resulted from the pregnancy. Of course, we know, the muscles and the joints, everything's got to get back to normal, and continuing on with this activity afterwards really helps greatly in reducing stress and promoting that overall holistic wellness, as well as stability. And then, of course, as I said too, depending on if this is first baby, sometimes there are challenges with that. So these, yoga postures and the regular breathing, it all helps to sort of navigate that journey a little bit easier. There's an option to include a supportive partner in yoga postures, and also relaxing positions for labor. So within a prenatal yoga class, you'll have lots of attention to breathing, but then also the physical postures, which help with strengthening and lengthening the muscles in a very, very gentle way, but also the aspects of meditation and relaxation within themselves are great preparation for labor, delivery, and post-recovery. And then lifelong healthy habit building, and it is, of course, an overall holistic self-care tool. And I can't stress that enough. It is a beautiful way to remain active while promoting all those other areas of health and wellness as well, such as the emotional, mental, and spiritual aspects. So there's lots and lots of helpful resources that I sort of refer to for this presentation, as well as gathered some information from, and some of the things you might already be familiar with, such as the Sweetgrass Prenatal Yoga DVD is a beautiful, amazing resource for moms-to-be. The 7 Generations Gestational Diabetes Prevention Program Pregnancy Wellness Toolkit, also the Canada's Food Guide, newly revised in 2019, the Sensible Guide to Healthy Pregnancy from Health Canada, and then of course there's the link for the Canadian Guideline for Physical Activity Throughout Pregnancy, found on the Journal of Obstetrics and Gynecology website, in case anybody's looking for that. The PARMEDX for Pregnancy, which, as I showed, was from the Canadian Society for Exercise Physiology and based on the Canadian Guideline for Physical Activity Throughout Pregnancy. Diabetes Canada, I wanted to mention the glycemic index from Diabetes Canada. I personally like the glycemic index as a, I guess you could say, additional healthy eating tool, because it does grade or sort of classify carbohydrate-rich foods according to how quickly they cause an elevation in blood glucose levels. So again, there's a PDF document on the Diabetes Canada website, and you can also just Google it, and you'll see that it classifies those carbohydrate-rich foods from low, medium to high. And I think it's just really beneficial to become familiarized with those foods, because they help us to understand in terms of stabilizing our energy levels. And again, especially if mom is at risk of gestational diabetes or coping with gestational diabetes, it's especially important for that. And then there's Telehealth Ontario, the toll-free number to speak to a dietitian for free, evidence-based nutrition and healthy eating information. I believe it was previously Eat Right Ontario. And there's lots of information there if anybody would like to access those. So at this time, I just want to open it up to some, questions or discussion. Maybe Jessica would like to moderate that.
Thank you, Crystal. You always do pull together such important information, and it's nice to have it all in one place. We do have one comment sitting in the chat box right now, and I'll certainly encourage other people, if you have any questions or comments, to add them to the conversation. Gwen says that she finds her clients have difficulty with the round ligament pain in the 3rd trimester or low back pain, and it bothers them while walking. She recommends them to get a belly support belt. So that's just one tip from someone who knows.
That's a great suggestion. Yeah, I know even for myself, when I started when I was walking in my 3rd trimester, right to the end, right to the very, very end, also pelvic pain can be a challenge too. I guess not much we can do to get away from that. And each person, the level of discomfort there will vary from person to person as well. But I know that can be very uncomfortable too. So thanks for that suggestion, Gwen.
Great. I'm not seeing any other questions here. I will give people just a moment to compose their thoughts, because I know sometimes you need to process the information before you can ask a question.
Yeah, it was a lot of information in a very short time frame. I just want to emphasize that I do think it is really, really important to notice those recommendations from the Canadian Guideline for Physical Activity throughout pregnancy, because there is still a myth out there that, physical activity during pregnancy can cause, serious complications. And the only way that might be, even remotely true is if there are already complications present. So it is definitely important to get that consultation and have that communication with your healthcare professional, because if you're unsure and if you have experienced any of the things that I mentioned in terms of contraindications, then certainly a conversation needs to be had around that. But it's important to note that these health professionals who have developed this guideline do highly, highly recommend physical activity during pregnancy in the absence of contraindications. Because honestly, the benefits of physical activity are so tremendous. And unless there's a serious complication, it's safe to say that it says the majority of women, the majority of pregnant women will benefit from incorporating aerobic and muscular exercise into their routines.
Mm-hmm. So Brianna says, so it isn't too late to start moving at 32 weeks pregnant?
I don't think it would be too late at all. But again, it just depends on the individual. So if somebody's 32 weeks pregnant, I'm not one to say get moving, because I don't know the health status of the individual. I don't know about potential difficulties or potential complications that a 32 weeks pregnant mom might be dealing with. So, but if the doctor gives clearance and there's no contraindications, judging by these guidelines, that it's never too late. It's never too late to start moving. And, again, that's just, according to the guidelines and the many different beneficial effects of physical activity. So definitely, though, consult with your healthcare professional around that. 32 weeks is far along, but it doesn't mean that mom can't benefit from regular activity.
Yeah, usually as long as the doctor
gentle.
Yeah, usually as long as the doctor Usually as long as the doctor says it's okay, walking especially is considered to be just fine. And actually, walking and gentle physical activity, even starting at 32 weeks, can help you have usually a kind of smoother go of it towards labor and delivery. So that can be something you might want to ask about for yourself or a client. Somebody is
definitely, and that's why I wanted to make. Oh, sorry. Go ahead, Jessica.
Oh, someone was just asking about resources, and I was just going to let them know that they can email me. I'll put my email in the chat box if they want to know more about the resources or the prenatal yoga DVD, but we will let you know that at this time our head office is closed due to COVID restrictions, so we can't actually mail anything out for the time being. But if you are interested in resources, you can let me know, and I can keep you posted on how to access those in the future. Sorry, Crystal, go ahead. I think you had something else to say about the previous question.
Oh, I just wanted to reflect a little bit more on, yeah, I just wanted to reflect a little more on that, the walking. That's why I made a special, dedicated a whole slide to walking, because it is so overlooked. And again, there's just this perception that, real exercise is going to the gym or using specific equipment. And, walking is engaging all of our major muscle groups, is engaging, our muscles, our bones, our lungs, our heart. So it is a very holistic exercise as well. So, and especially if we gradually start to build on that walking routine in terms of the FIT principle, which is the frequency, the intensity, and the time and the type, you can really make adjustments to just a simple walking routine and definitely see improvements that way as well. Oh, Jessica's frozen. Can everybody still hear me? Can somebody type in the chat box? Oh, can you hear me?
I can hear you. You're looking a little bit
good,
heavy, but I don't know if it's on your end or my end. We'll try.
I'm not sure, but your face is frozen.
We do have one more question here regarding prenatal vitamins. When is it best to start taking them, trying to conceive, and how long after birth can you take them? Can you take them while breastfeeding? Can you please explain this?
I think that's definitely a question best suited for the healthcare professional. To my understanding, the prenatal vitamins can be taken right as soon as mom finds out that she's pregnant. I don't know about beforehand. I started mine right after I was confirmed to be pregnant myself. And so I don't really know about the best time, but I do know that in my own personal experience, I was prescribed my vitamins right after. So consult with a healthcare professional, I think, is the best bet to go.
Yeah, it's always a great idea to consult. I know in my own experience, it is okay, or at least, again, always consult with your doctor, but from my own experience, they do recommend if you are planning a pregnancy that you do start taking those vitamins even 3 to 6 months in advance, just because it can impact your iron levels and your folate, which can all have benefits. But again, not speaking as a physician here. So best to always defer to your own healthcare team if you are thinking about planning a pregnancy or if you are currently pregnant. We do have one more comment here. Someone says you can get free prenatal vitamins from Sobeys. It's part of their Growing Healthy Babies program at the pharmacy. That's wonderful. And someone else says, I was unaware of the benefits of core exercise with first-time pregnancy. It feels like learning about my body all over again. Thank you for the extension of resources to reference.
You're very welcome, Brianna. And really, when you think about, even if it's important to acknowledge that our core is always engaged. So even if we're just sitting in a chair and we're sitting up tall and practicing a good posture, we're engaging our core. When we're walking, we're engaging our core. When we're going up and down the stairs, we're always engaging our core. And so when the the recommendations talk about upper body exercises and whatnot, and then lower body exercises, it's really just kind of differentiating between the different parts of the body, but emphasizing looking at all the major muscle groups of the body just to promote overall strength and stability. So for sure, like in terms of core, chest, chest is also included. You might do some gentle, very gentle push-ups off of the counter, for example. There's so many ways to engage these muscle groups of the body. It doesn't have to be strenuous in any way.
Perfect. I just wanted to add here, those that are interested in our prenatal yoga video, the Sweetgrass Prenatal Yoga. I'm not able to send out the DVDs right now, but it is available on YouTube, and I've just chucked the link into the chat box.
Yes,
so
it's really, really nice. So if you want to share that with your clients, I encourage that too.
So it is available to you there, and I have put that in there. I'm not seeing any more questions, Crystal, so I think we'll move on. I just have one more slide to share myself. Oh.
Can I just mention one more thing, Jessica? Before we close up? I just wanted to mention, so in regards to frontline worker programming for pregnant moms and community programming and groups and whatnot, it's really nice to start, talking amongst your team about how to promote physical activity in general amongst your community members and your groups, as well as pregnant moms. So I do work with one group, well, when it's not COVID times, I do work with one group, one dietitian who has a prenatal group, and I take them through some gentle postures and breathing and all of that stuff, just so that they can sort of get kind of refamiliarize with their body, connect with their breath. And it's just such a beautiful thing to really celebrate our bodies in that way. So I really highly encourage having those conversations with your teams in order to start. Well, some of you are probably obviously already doing that, but for those that are looking for new ways and ideas, get the conversation going and think of ways that you can really motivate and inspire your community members to be more active, because I cannot stress enough the importance of physical activity, even if it's just gentle physical activity, because we need it. We need it for overall health, strength, stability, independent living, all of those things, right? And it needs to be well-rounded. So you have the strength portion, you have the gentle stretching, or yoga if that's what you like, but definitely the gentle stretching and maintaining a healthy range of motion, and then also the aerobic aspect of getting the heart and lungs working a bit beyond their base. So with that, I just want to say, Nyawa, everybody, Nyawa Goa, and Miigwech, thank you very much for allowing me to share this with you today. And I really hope that we get into lots of discussion in the next session, where we start to explore more about creating these programs and enhancing our existing programs. And I'm sure Jessica will talk a little bit more about that.